Good evening, delegates and participants. Thank you for joining Shield Connect. And today we are with a well-reputed doctor from Pune, Dr. Sagar Gulabam, and sir is going to take topic awareness on cervical cancer and pap smear. As we know, this month is about cervical cancer awareness. So before I start with the session, let me give a quick introduction of our speaker for the day, Dr. Sagar Gulabam. Sir is director of Sri Tirupati Healthcare Private Limited, Bump Nursing Home. Sir is panel consultant at Sahyadri Hospital, Ruby Hall Clinic, as well as in Noble Hospital and Cloud9 Hospital in Kalyani Nagar. Sir is a life member of Foxy, IMS, IMA, and TCOS Society. So I welcome you, sir, on our platform for today's webinar. Thank you, sir.
Thank you, Shield Connect and team. First of all, a very good afternoon to all of you and the delegates also. So today we are going to speak on a very important topic, that is awareness on cervical cancer and pap smear. As Nishant has said that this is a cervical cancer awareness month. So we are conducting many CMEs and lectures so that the general population is also made aware that the cervical cancer can be detected early and can be treated if we have an early diagnosis. And by early diagnosis, the first thing that comes to our mind is pap smear. So we will start the CME. So naturally, our aim is that we don't want any of our women suffering from cervical cancer. And we all know that cervical cancer is the second most common cancer after breast cancer in the women. And it is responsible for 6.6% of the female cancer deaths worldwide. So every year, around 1.3 lakh Indian females are diagnosed with cervical cancer. So this is a very huge number. And the second thing which is worrying us is that most of the cases which are diagnosed with cervical cancer stage 3 and 4, which is a very late stage for diagnosis. And then we don't have many options available for the treatment. And the survival rate is also less. So our aim is that we should reduce the number of females diagnosed with cervical cancer, and we should diagnose them in the early stages or the precancerous stage where we can treat them well. Okay. This also we can see that out of every two, one woman will die of cervical cancer in India, which is a very huge number. As we all know that most of the cases of cervical cancer, you can say 99% are caused by the human papilloma virus. So this human papilloma viral infection is a sexually transmitted disease. And it is very, very common in both the boys and the girls. But we should remember that it takes a pretty long time, that around 10 to 15 years are required for cervical cancer to develop in a woman who has got a normal immune system. So this is very important, a normal immune system. So we are going to study what lifestyle changes we can do so that we have a good immune system. And another thing is that if a person's immunity is less, that is, if a person is HIV positive, then there are more than 5 times chances that the person is going to develop cervical cancer. So as we have discussed that, almost all 99% of the cases are linked with the human papilloma virus, which is transmitted sexually. So we know how the where the cervix is and how the cancer will occur. So this is also very important to remember that at least half of the sexually active people will have human papilloma virus at some point. That means we understand that it is a very common sexually transmitted disease, but it is not common to have cervical cancer because people with good immunity will take care of the viral load and it will not develop into cervical cancer. So only a few women will get the cancer. So this is a short study of the cervix. This is the anatomy of the uterine cervix. So this outer part which is exposed to the vagina, this is the ectocervix. This inner line which you can see, which is little more reddish, generally it is the endocervix. And on the transformation zone is the between the lining between the two layers is called as a transformation zone. So there will be two transformation zone. One is the new columnar squamocolumnar junction, that is the transformation zone is between the new and the native. So what happens is when the endocervix, the ectocervix is exposed to the hormone of the estrogen, this new squamocolumnar junction will be formed, and the part between the new squamocolumnar junction and the native squamocolumnar junction is known as the transformation zone. So why we are giving so much of importance to this transformation zone? Because all the cervical cancers are going to develop in the transition zone. So this is a very important zone and we should always be able to identify the changes that occur in this squamocolumnar transition zone. Okay. So when a lady goes into menopause, then what will happen is that this squamocolumnar junction will be shifted inward and then you won't be able to see the transition zone. Okay, that is the importance. Now we come to the signs and symptoms of cervical cancer. So we have to remember that most of the signs and symptoms are developing late, and that is the reason why we are not able to diagnose them early. Like pain in the pelvis, if there's the presence of a vaginal mass, naturally that is very late. There are some signs and symptoms which are not very specific, like lack of appetite, unexplained weight loss, pain in the back and legs, fatigue. And late signs and symptoms will be heavy vaginal bleeding. So what we have to look in the early part is the bleeding during or after sexual intercourse or between two menstrual periods, that is the intermenstrual bleed or the postmenopausal bleeding. So these are very, very important and we should immediately diagnose or do the investigations when we get these symptoms. Another important symptom is the blood-tainted vaginal discharge with a strong odor. So these two are very, very important, which warrants immediate investigations. So suppose a person has cervical cancer, then there will be so many complications. That is pain. Then there will be metastasis towards the ureters and then naturally towards the kidney problems. Then there will be swelling of ankles and feet, shortness of breath, fatigue, and late is fistula and stroke and blood clots. So these are the few complications which will occur if they are not diagnosed early. So now we come to the important thing is the causes and the risk factors. So as we have discussed, the human papilloma virus is the main cause and the other are the gene abnormalities. So when the healthy cells in the cervix undergo mutations and they are not stable, then these gene abnormalities will develop into cervical cancer. So this is another high risk factor is if the person has got multiple sexual partners, then the risk of exposure to HPV and then other sexually transmitted diseases will also increase. Second is the having or beginning sex at an early age will also increase the risk of HPV. and naturally later cervical cancer. Other sexually transmitted infections such as chlamydia, gonorrhea, syphilis, and HIV, this also increase when there is early and sexual activity and multiple partners. Suppose a person has weakened immune system, as we have discussed, if a person is seropositive or having severe anemia or hypoproteinemia, then there is a very high chance that this person is going to develop cervical cancer after the HPV infection. Smoking. So this is a very important high risk factor, and the chance of a person developing cervical cancer is more than 2 times than normal population when the person is smoking. And as we are now seeing that so many women and girls are started smoking. So this is a lifestyle modification which we need to do or tell the general population. And of course, family history. So this, what is this human papilloma virus? So human papilloma virus is a double-stranded DNA. It is circular and it is protected by a capsule. So it is a protein capsule which is protecting it. And there have been 100 different types of HPV which are known. But which are the important one is HPV 16 and 18, because this causes 70% of all the cervical cancers. The other common are 6, 8, 11. So these are the common which will lead to cervical cancer. So other type of human papilloma virus are those which will cause warts and other diseases. Okay. So in short, what we are seeing here is when the infection or when there is exposure of the virus to the epithelial cells in the cervical mucosa, this HPV DNA will integrate into the cellular genome and cause cancer. So it requires few weeks when normal shedding of the cells will occur and this infection will get treated on its own. So it will not get integrated into the lower layer of the cells and into their DNA, which will lead to cancer. Okay. So most of the cases, there will be healing of the infection in a few years. In very few cases, and especially when there is low immunity, then in a time span of 10 to 30 years, only 0.8% will develop cancer, and which will invade the basal layer and it will spread. Then the cancer has occurred. Okay. So we know that the Nobel Prize in 2008 was given to Professor Dr. Harald Zur Hassan, who was a German scientist in Heidelberg, Germany. So he founded the relationship between HPV and cervical cancer. And that time the debate on whether HPV is the causative factor for cervical cancer ended. And now we can be 100% sure that it is a causative factor. So the corollary is that the cervical cancer cannot happen without HPV. So HPV is necessary for the cancer to occur. So this is very interesting that males are the carriers of this sexually transmitted disease. But usually they will not have any symptoms. But most of the burden is present in the females. They have to suffer many times, as we see in other scenarios also. The current vaccines in use do not provide protection against the other problems such as the anorectal warts or the melanoma skin cancers. So looking at the scenario of cervical cancer and the incidence, the World Health Organization has developed a strategy plan to eliminate cervical cancer. So according to this, what they are saying is that 90% of the girls up to the 15 years should be vaccinated. 70% of the females who are aged between 35 to 45 should be screened and with the help of a high sensitivity test. And most of the women, that is 90%, should be treated of the cervical diseases which we have diagnosed when we do the screening, and they should be treated successfully. Only then we can reduce the burden of the cervical cancer. So the World Health Organization has stated that if these goals are reached by 2030, only then we will be at a stage where we can eliminate the cancer by 2019. So this is a very high goal, I feel, but at least we should start. So I have discussed this before, that there will be latent infection and the viral DNA will get integrated into the DNA of the cell, of the squamous cell. And if they are not cleared by this due to low immunity, or if it is reinfection, then what will happen is that they will be converted into high grade lesions, and then eventually they will progress to invasive carcinoma. But the percentage is very less, 0.8 to 1%. Sorry. So this is one of the potential mechanism for the spread to the breast also, that this is an hypothesis that how the breast is getting infected. One is by sexual transmission, one is by direct contact of the genital region with the breast, and viral spread from the original site of the infection to the breast to the bloodstream. So there are so many myths about HPV infection. We will just discuss a few of them. Okay. So one of the myths is natural infection protects, so there is no need of vaccination. So this is not true. So even if you have not got infection or got infection, you have to have the vaccination. Vaccinated children never experience HPV infection and never have HPV associated diseases throughout their lives. So when the children are vaccinated, they will have a HPV infection, but it will be mild and it will help them to clear the infection faster, and the risk of cervical cancer, of them developing cervical cancer, is very less. Okay. So the another myth is vaccination will cure the related disease. So vaccination is prophylactic. It will not cure the disease which is already present. Okay. So another thing is the antibodies which are developed or which are in the blood are important, and the protection loses its effect when the antibody level drops. So this is not true. So even if the antibodies level drop, suppose after a few years, still there is an innate immunity, and the antibodies will again develop at a faster rate when it is again exposed to the virus. So herd immunity, we all know what is herd immunity, which we know through COVID. So they are saying that that is a myth, that herd immunity does not exist, but it is not true. Herd immunity is there. So if we have vaccinated most of the population, then naturally the risk will reduce. Vaccinations are not effective when done at later ages. So vaccinations are effective at all the age groups. Only thing is, now we are recommending that vaccination should be done at a earlier age group, that is after the age of 9 years or before the sexual activity, but be earlier. But even if the patient or the woman comes to you, suppose at the age of 25, she has had a child and she needs to be vaccinated, you should offer her the vaccination. You should not refuse the vaccination. Okay. Smears and HIV tests need not be done before the vaccination. If pregnancy occurs during vaccination, that means if a person has taken the first dose or she's taken the second dose and she gets pregnant after that, there is no role of an MTP. So the pregnancy should not be terminated. The patient or the mother should be counseled that it is not going to affect the baby. The, the other doses which are remaining should not be given. They should be given after the delivery. So another thing is that what happens is the girls who are young girls who have been vaccinated, So there is a myth that they feel more sexually comfortable, and there is a risk of higher rate of sexually transmitted disease. So this is not true. In fact, we should look at it that there should be good counseling, that they should get protected from the sexually transmitted diseases by the use of condoms. The important myth is also autoimmune diseases such as primary ovarian deficiency and Guillain-Barré disease have a higher rate among vaccinated children. So this is absolutely wrong, and there is no studies which proves this. Okay. If there is total protection against types of vaccination, then cancer prevalence of other types will increase. So this is also not true. There are no deaths reported to the vaccine, and the vaccines are cost effective. Okay. So these are some of the common myths which we have already said that they are not true. So now why we know that screening is very, very important, because we know that the incidence is so much that 1 in 50 will develop cervical cancer. Okay. So as we know that a person or the woman or the girl will not know whether she has got human papillomavirus infection, because there will be no signs or symptoms. So what is the way out is that we have to screen. That is the only way we can protect our women and the girls. So now we are in the era of prevention. So to reduce the risk of cervical cancer, what are the preventive measures? So one is the lifestyle changes and diet modification. So lifestyle changes is that smoking, we have to advertise, we have to give this message clearly in the society that smoking is injurious to the health, not only for the respiratory system, but for the genital health also. Lifestyle changes that multiple sexual partners should be avoided, use of condom to prevent sexually transmitted disease, diet modification for good immunity, having a good HB, hemoglobin, iron-rich diet. So these are the lifestyle and diet modification. Second is the HPV vaccination. So HPV vaccination, now the government of India is coming out with an initiative that they are had a tie-up with Serum Institute of India. Yes, you heard it right, that they have a tie-up, and the Serum Institute will be providing this vaccine at a very cheap rate in the government hospitals and the PHC centers, where they can be given to the girls at an early age group. So this is a very good initiative. Then the other thing is we have to stress the need for routine PAP test. This is very, very important. This I have told, and smoking. So these are the very three simple steps which we can follow to prevent cervical cancer. One is the vaccination, second is the pap smear with regular follow-ups, and the HPV test. So now we come to the vaccination. So there are two types of vaccines which are available currently, and the third is going to be coming, which is of the Serum Institute, which is much, much cheaper than these two. Okay. So the Cervarix vaccine, it is a bivalent vaccine. That means it will protect against only 16 and 18 subtype of the human papillomavirus, and it will give protection only against the cervical cancer. So the cost of both the vaccines is around 2,500 to 3,000 for one dose. And we are recommending it, at least there should be 3 doses. And the second is the Gardasil. So Gardasil, it will give vaccination. This is also a recombinant vaccine, but it is giving protection against 6, 11, 16, and 8. So 4 types of viruses it is going to give protection. and it is also going to protect against the genital warts. So you can say that Gardasil is slightly better than Cervarix. Okay. So now they have come out with a study that instead of 3 doses, to reduce the cost, and they have done quite a number of studies, that we can give 2 doses, one at the first and after 6 months, and you get a good robust immunity which will protect for the cervical cancer. So there is going to be a change in the recommendation in a few years. So now we come to who are the population or whom should we recommend this vaccine to. Okay. So we should remember that now in India we are giving to girls and women through 19 to 26 years of age, and the dose is standard 0.5 milligram intramuscularly. Okay. So Gardasil, it is given. So there is a slight difference between these two. Gardasil has to be given at 0, 2, and 6 months, and Cervarix has to be given at 0, 1, and 6 months. As I said that in young girls and women, we can now think of giving only 2 doses. So this Gardasil 9 is going to protect again 9 different viruses, and but it is still not available in India, but this is also a good option. So here we are seeing that we are writing that it could be males also. So in Australia, in UK and US, the recommendation is that the vaccine has to be given to the boys and the girls. So the risk of human papilloma virus, oral warts, and the adenocarcinoma of the colon all will reduce when we are giving the injections to both the boys and the girls. And naturally, as we have discussed, that the boys are the ones who will transmit the disease to the girls. So if both are vaccinated, then it makes more sense and it will help reduce the incidence faster. But the problem is that the cost. So we are now, till now, we are recommending only for girls and women. Okay. So now we come to the second part, that is the pap smear. So pap smear, it is a very quick and a painless procedure where we take the cells or the exfoliated cells or the cells which are on the cervix and in the fornices and send them for histopathological examination under the microscope. Okay. Now we have now come to a modification that we are doing a liquid-based cytology, that is called as the LCB, which is a little better test in the sense that now we are saying that the lady or the woman can take the sample herself, so that she doesn't need to go to the center to have the pap smear, and also she will not feel awkward to collect the pap smear. Okay. The only thing we have to remember that this pap smear is a screening test, and it looks at the abnormal cells or the precancerous cells. And once we have diagnosed that there is an abnormal pap smear, then we have to do screening test. Usually we will do a colposcopy, or we will take a tissue biopsy or a cervical biopsy. There is also one way known as the VIA, that is visual inspection under when we are applying Lugol's iodine. Okay. So pap smear, we have understood that it is a quick and painless procedure. Now we can do a pap smear with a liquid-based cytology method. The woman can herself take the sample. If there is an abnormal pap smear, then we have to do a confirmatory test. So the basic will be visual inspection under after staining with Lugol's iodine, or if you got the opportunity or this facility, you can do a colposcopy or you can do a cervical biopsy to diagnose cervical cancer. Okay. So the screening time is between 10 to 20 days after the menstrual period. The woman should not do the douching or use spermicidal foams or creams because these agents may wash the abnormal cells. Okay. So this is important that the pap smear are very accurate and they will help to reduce the cancer rates by and the mortality by at least 80%. So it is a very effective tool, but you have to use it well and consistently. So this is also a very important thing is how often do we need to do a pap smear? So if the girl is 20 or younger, there is no screening required. As we have discussed, there is no need to screen before the vaccination. So we just give the vaccination. If she is less than 20 years, no need of screening. Then in the age group 21 to 29, pap smear should be done every 3 years. Between 30 to 65, the pap smear should be done every 3 years. And pap smear and HPV test, if both are done together, you can do it every 5 years if they are negative. Okay. And if the person is 66 or older, if you have 3 normal pap smears or 2 normal HPV tests in a row, then we can stop doing the screening for that lady. So how do we prepare the person for pap smear? As we have said that there should not be menstruation. This all we have discussed that they should not use any sprays or douche or creams so that it will not interfere with the readings of the test. So we all know how the test is done. So we have to remember that we should not use any cleaning or lubricating liquid to clean the vagina and the cervix. Second, make the patient comfortable and expose the cervix. You can do it with a cuscos also. And we have to use the special brush to take the sample from the cervix. So you have to put it at the external os and rotate it in the anti-clockwise for 3 times. And then you have to dip it into the liquid. So this liquid is there in which you have to dip this, turn it 3 times so that you free all the cells and then label it and send it for histopathological examination. So generally nowadays we get the report between 4 to 6 days. And if the test is negative, then there is no other thing to be done except that you should call the patient for the next follow-up. If it is positive, then we have to take the next steps. Okay, so as we have discussed. So what are the types of report which will come is there will be mild inflammation or minor cell changes. Another thing that the report might show that there is HPV infection, or it may show that it is a precancerous or the cancer cells are present. So generally for mild inflammation, we will give her some pessaries depending upon the type of infection which there is. If there is an HPV infection, then maybe we'll do a colposcopy, see if there are any abnormal lesions and take a biopsy. Okay, for this also we need to take a biopsy. So biopsy is compulsory. So the advantage of doing a colposcopy is one is that we diagnose it there and then that there is an abnormal lesion. And once we diagnose it abnormal lesion, we can treat it in the same setting with the help of a loop. Okay, so I will show you a picture in which you can take the biopsy. So this I've already said that we can do a colposcopy, and during colposcopy we can do the treatment also by taking the loop. Also we can do cauterization, but we have to be sure that it is not malignant. So this is the loop which we use to remove the abnormal area. And this is a very effective tool and which will reduce the incidence of cervical cancer and unnecessary operatives like hysterectomy. So this is a very important tool. Okay. So it is also known as the loop electrosurgical excision or the loop diathermy. And it takes very few time, 15 minutes, and can be done under local anesthesia. So as I was saying that you can do a cryo cautery, or you can do a thermal cautery, or another is we can do a laser therapy. So in cryotherapy, what we do is we take this probe and apply it on the cervix and the affected area, and we freeze this area. So these cells are exposed to minus 120 degrees temperature, and with that it will kill the abnormal cells. So this is a very effective method of treating the abnormal area. I personally used it in many cases, and I find the results very encouraging, and the patients are very happy. And most of them will not have any complaints of discharge, itching, burning. All those symptoms will be relieved. So in this, once you apply the temperature and once there is freezing, then you have to give some time, around 1 minute, for it to thaw, and then remove the probe. Second is the thermal cautery, which we all know, where we burn the abnormal area, and then there will be growth of the new tissue. So this immunotherapy, chemotherapy generally is not used in our setup. Um, so we won't discuss much for that. So now we come to the last slide, that is the take-home message for all the people, all the doctors, all the general practitioners, is cervical cancer is very common, and it is a preventable disease. And if we counsel our women that they should undergo pap smear. So even if they're coming for a routine ANC checkup, we can tell them that you have to come for pap smear after you deliver. Even if they come for MTP services, they come for TL. So we should keep on counseling them that pap smear is very important, and it should be done at a regular basis. Because I feel what happens is when we do a pap smear, they feel it is negative and they don't come again for follow-up. So that is very important. We can also counsel the women that those women who have got daughters, they should get their daughters vaccinated. So it is a long process, but it is possible. Routine screening will save many lives. So here we are saying 100% of the people will be diagnosed earlier, and their cancer survival will increase definitely. Okay. So we all hope that girls will get vaccinated at the earliest, around 10 to 12 years, and we will also vaccinate the boys, and will reduce the cervical cancer rate and the death rate for the women of our country. So we should all take a pledge that no woman should die from cervical cancer. Okay. So I take this opportunity that this being a cervical cancer awareness month, everyone should at least screen 1 or 2 patients in the next 1 week. And if there is any difficulty, if there is any questions, I'm ready to answer. And also we have to focus on vaccination. Okay. So thank you everyone for your patient hearing. If there are any questions, you can raise the hand, or you can type it. Then we'll just see the questions, and I will try to answer as best as possible. Over to you,
Yes, sir.
Nishant. and the
Thank you so much,
management.
sir, for giving your valuable time and giving so much crisp information regarding this topic, cervical cancer and pap smear test. So let me check if I have any questions from the Shield Connect page. Give me 1 minute, sir.
Yes, yes.
So, sir, one of the question is what tips you would like to give to your patient who are anxious coming for pap smear test?
Okay. So the tip is that the woman should not be unnecessarily scared and anxious that it is uh, going to lead to diagnosis of cervical cancer. It is a
Mm,
screening test, and it
mm.
is going to in fact help her reduce her stress. So that is very important. Second is that she should not have her periods in the last few days, and she should not use any chemicals or douching, so that we can get a proper test.
And I received one more question. Does pap smear test detects STIs?
No, so pap smear is going to detect only the abnormal cells,
Mm,
but now we have got one more test which is called as the STI test, which we do with the same type of sampling. That is, we take the brush and then we take the sample either from the vagina or the cervix, and then we send it for the sexually transmitted diseases. So this is also DNA sequential based testing, which will help diagnose the different types of sexually transmitted diseases. But
mm.
pap smear will not diagnose.
Okay. And sir, the last question is any idea about this serum vaccine, Cervavac, which will be available in hospitals?
So the vaccine from the Serum Institute, they are saying that it will cost around 250 to 500 rupees, and it
Mhm,
will be free of cost in the primary health centers and the government hospitals. And they are looking at 2 doses.
mhm.
But it is, we don't know exactly when it is going to start. But last I read it in the papers last week was it is going to start in a month or so.
Okay.
But of course, it will be in a phase manner because the
Mhm.
production has slowly to build up.
So I cannot see more questions. Thank you so much, sir, for giving all the answers for these questions. I hope sir has provided all the answers to your questions, participants. And we are glad to have you, sir, on such important information on this awareness month regarding cervical cancer. And we would like to have more sessions with you in future on such
Thank you.
awareness programs. Thank you
Thank
so
you.
much, sir.
Yeah, and I take this opportunity to thank Shield and the team and Nishant also for organizing this. And this was a very important CME, and I'm very glad that we are associated with Shield. Thank you so much.
Thank you so much, sir. Bye, sir.
Bye. Can we close the, or we need to wait for a few minutes?
Sir, we can close the session.
Yeah,
This
we can close.
session will be live on, will be remaining on Shield Connect page as well on YouTube page of Shield Connect.
Oh,
So I
great,
will
great.
share that link also with you. So,
Okay, great, great.
okay,
Thank
sir.
you. Okay,
Thank you,
bye.
sir. Bye, sir.